Hello, my name is Grace Nye, and my report is on botulism. Just a quick overview of the disease. It is caused by a bacteria Clostridium botulinum, a bacteria which can produce a neurotoxin which causes muscular paralysis in humans, starting with the face and descending to the rest of the body. If it progresses and affects the muscles involved in breathing, it can cause respiratory failure and even death. This disease is also very rare. There's only about 1,000 cases worldwide per year. The bacteria Clostridium botulinum is gram-positive and bacilli and an obligate anaerobe. They live in soil and marine sediments worldwide. They're actually very common. Most people will encounter and even ingest them, but most people never get sick or suffer any harmful effects. This is because these bacteria form endospores, which are protective protein coatings, which can help them survive harsh conditions for many years. Under specific circumstances, they'll germinate back into metabolically active bacteria, which can then produce the botulinum toxin, which causes the disease. However, it is not well known or understood why the endospores germinate back into bacteria when they do, what causes this, and what mechanism it goes through. So several other species are also capable of producing botulism in humans. These include C. bairati and C. butyraicum. However, this is very rare. There's only a few documented cases of this occurring. So botulism is classified into 3 major types based on the mechanism of transmission. And this includes foodborne botulism, infant botulism, and wound botulism. There are several other minor types of the disease. However, they're very rare. There's usually only a couple of cases per year. So this includes iatrogenic and adult intestinal toxemia. Foodborne botulism is the form most commonly associated with the disease. In fact, the name botulism comes from the Latin word botulus, meaning sausage, because the first well-documented case of the disease occurred in connection with fermented German sausage in the 19th century. So this form of the disease occurs when spores germinate and produce toxins in the food. And then, when a person eats the food, the toxin is absorbed into their bloodstream or their lymphatic system, and then it circulates in the body until it binds to a nerve cell, where it causes the paralysis. The spores only germinate in the food under very specific conditions, however, so that's a completely anaerobic environment, a non-acidic pH, and a low salt and sugar content. And these conditions are usually achieved in unsafely prepared canned foods and fermented foods like home canning, Alaska Native dishes, and illegally brewed alcohol. It's very easily preventable just by following FDA guidelines for canning and preparing foods safely. Infant botulism, the second type, is actually the most common. It occurs when spores germinate in the intestinal tracts of children 12 months and younger and then produce toxins. So one theory for why younger children are more susceptible than adults is because the normal microbiome in their gut is not yet established, which makes it easier for the C. botulinum to colonize their intestines. However, again, the cause of the germination is unknown, and it's not understood why the spores germinate in the intestines of some children and not others. However, honey has been definitively linked to the disease. About 20% of cases are traced to it. So the FDA recommends not feeding honey to children less than a year old. The third type, wound botulism, is quite rare. This occurs when spores germinate in wounds, inside of a wound. It's most frequently the case with people who inject illicit drugs beneath their skin, such as black tar heroin, and also found after traumatic injuries that have been contaminated with soil, like motorcycle crashes and surgeries. The other minor forms include iatrogenic botulism, and this happens because the toxin is used for cosmetic or therapeutic purposes. Very heavily diluted forms of it are injected, such as in the case of Botox, it is injected into the face to reduce facial wrinkles. And if there's an overdose, this can cause the illness in the patient. The last form, adult intestinal toxemia, is the most rare and the most poorly understood. It happens when the spores germinate inside of the intestines, similar to infant botulism. However, the vast majority of adults can ingest and process the bacteria without getting sick, and it is unknown what causes the spores to germinate when they do. Most patients do exhibit histories of gastrointestinal abnormalities like gastrointestinal surgery or illness, or they recently took broad-spectrum antibiotics, which altered their microbiome. Now on to the botulinum toxin, which causes the disease. So very interesting. The toxin is the most potent toxin known to man. Just 1 gram has the potential to kill at least 1.5 million people, and this is according to a study done just this year. The lethal dose for an average man is 1 nanogram. That's 10 to the negative 9th. So it acts by blocking the passage of stimulus at nerve endings so that muscles do not receive the signal to contract. C. botulinum can produce 7 types of the toxin named A through G, but only types A, B, E, and rarely F are toxic to humans. The others can cause botulism in animals, though. The structure of the toxin is it's an AB toxin, so it has 2 subunits, which are polypeptide chains. The larger chain functions by binding to the cell, and the smaller chain produces the toxic effects within the cell. They're held together by disulfide bonds. The toxins work in the nervous system by blocking these signals that are sent to the muscles by the nerve cells. So what happens is the nerve cell body generates an action potential which is fired down the axon to the axon terminal. There it's converted into a chemical signal and fired across the synapse to the muscle cell, telling it to contract. So the toxin functions by binding to the axon terminal here and then entering into the cell. Once inside of the cell, it blocks the release of the neurotransmitter. The toxin also acts only on nerve cells which use acetylcholine as a neurotransmitter. And this is what causes the paralysis. Botulism has a series of unique and identifiable symptoms. They always begin with cranial nerve palsies, so that's a decrease or complete loss of function of the muscles in the face. Some symptoms of this are double vision, blurred vision, expressionless faces, as you can see over here, and some difficulty swallowing. This is always followed by descending symmetrical paralysis of the voluntary muscles, starting with the neck and then the shoulders, going to the arms and the legs and the torso. Some nausea and vomiting is also common, but it is not known if this is caused by the toxin itself or by some other form of contamination. Finally, respiratory failure may occur if the muscles involved in breathing are paralyzed. This is the most common cause of death. However, interesting to note, the sensory system is always unaffected, meaning their intellectual function is completely preserved. They're totally aware of what's happening, even while completely paralyzed. There have been cases of patients completely paralyzed and intubated who tap their fingers in order to communicate with their physicians. They're completely aware. So the treatment for this disease involves mainly the antitoxin and mechanical ventilation if necessary. The incubation period is usually about 18 to 36 hours, and most patients come to the hospital within 48 hours of their onset of symptoms. However, unfortunately, this disease is frequently misdiagnosed because it's so rare that most physicians just aren't familiar with it. Also, routine laboratory tests are not helpful at all to identify it. In order to 100% verify the diagnosis, they need laboratory confirmation of the bacteria or the toxin in the patient's stool or in their blood. So as soon as a physician suspects botulism, they need to administer the antitoxin because the sooner it's administered, the more effective it is. However, the antitoxin, it's only available from the CDC in the US, meaning that physicians have to contact the state health department as soon as they suspect botulism. Every single case is considered a public health emergency. If the patient goes into respiratory failure, which usually occurs within the first 2 days of hospitalization, they'll be put on a mechanical ventilator, and it can take weeks and even months to recover from paralysis, and we'll talk more about why that is. So now let's talk about the antitoxin and how it works. The antitoxin used for adults today in the US and in Europe is the equine heptavalent botulism antitoxin. So equine because it's developed from antibodies of horses, actually. And this is effective against all 7 types of the toxin, A through G. And how it works is it binds to free botulinum toxin circulating in the body and neutralizes it. It does not bind to toxin which has already entered into a nerve cell. And this is why it can only stop the progression of the paralysis. It cannot reverse paralysis that's already occurred. So this is why recovery can take weeks to months, because the body has to regenerate those nerve cells on its own, which can take a while, and in order to recover function. The antitoxin used for babies in the US is called Baby Big, and it was actually recently discontinued this year. They are coming up with a new formulation, which is probably going to be very similar. And this uses human antibodies as opposed to horse antibodies because there's less chance of an allergic reaction occurring in kids. So now some facts about the incidence and mortality of it. It's very rare. There's only about 1,000 cases per year worldwide, and only about 150 cases in the US. On 2017, 77% were infant botulism. So this is the most common kind, as you can see. Here's a map of infant botulism in 2017. About 50 years ago, so before 1960, it had a 50% fatality rate, but because of advances in critical care, especially in mechanical ventilation, today it's only about 5% fatality rate in the US. As mentioned previously, the botulinum neurotoxin has been employed for a number of uses, both good and bad. So some good uses include some cosmetic and therapeutic applications. We have Botox, used to reduce facial wrinkles. It's also used to treat spastic muscular conditions, like movement disorders, where people's muscles contract uncontrollably, like dystonia and post-stroke spasticity. And it's also used to prevent and reduce chronic migraines. Another usage is for bioterrorism. Since botulinum neurotoxin is the deadliest biological substance currently known to man, both national governments and terrorist groups have stockpiled botulism toxins for their own purposes. The CDC has classified it as a Category A biothreat agent due to its extreme toxicity and ease of production. Studies have shown it could be aerosolized and weaponized efficiently. The Soviet Union and Iraq are examples of governments that have tried to weaponize them in the past. The federal government is aware of this threat, and antitoxin is kept ready in secret locations around the country by the Strategic National Stockpile. And this is why current attempts are also being made to find better antitoxins for it. However, they don't want to try and develop a vaccine, because if they did, then they wouldn't be able to use the toxin for the cosmetic and the therapeutic purposes that we have also been developing for it. So that's botulism, very interesting disease, and I hope you enjoyed. Thanks.